Hi, thank you for watching Digging to China. I'm Dong Shong. If you have not done so already, please subscribe to my channel. Thank you very much. On Tuesday, December 20th, at a National Health Commission briefing in Beijing, Wang Guiqiang, a top infectious disease doctor, told reporters that China will only count people who tested positive for COVID and died of respiratory failures as official virus death. People deemed to have died due to another disease or an event like a heart attack won't be classified as a virus death, even if they were sick with COVID at the time, he said. There has been speculation that Beijing's low official tally is hiding the true picture of the chaos unleashed by this month's abrupt pandemic pivot. Other countries have a wider definition of COVID death. While health authorities in some nations do note that the virus might not be the ultimate cause of death in a positive person, most still include such fatalities in their COVID death tallies. COVID can cause other conditions like blood clots that then trigger things like a heart attack, and the virus can also hasten death from another ailment. The US attributes a death to COVID regardless of whether the infection is the underlying cause or a contributing factor. New Zealand will record a COVID death in anyone who dies within 28 days of a positive test result. The UK, meanwhile, determines whether a death is due to COVID or just involves COVID based on the underlying cause. But both kinds of fatalities will still be recorded as COVID death in official statistics. Previously in China, anyone who died while COVID positive, no matter their underlying condition, would be classified as an official COVID death. And as recently as December 15th, the National Health Commission told Western media that definition was still in place. Chinese media outlet Caixin had reported that the Chinese regime had quietly changed the guidelines earlier this month, rolling out the narrower definition just as its dismantling of COVID-0 sparked an explosion of infections. But the rapid rise in cases has notably come with very few deaths, putting China at odds not only with the experiences of other countries but even with Shanghai and Hong Kong. There are concerns that officials are seeking to mask the real number of fatalities. China's change not only means its death tally likely won't be comparable with other countries, but also with the fatalities it recorded at other stages of the pandemic. China has reported 5,242 official COVID deaths since the pandemic began. On one hand, China reported fewer than 10 deaths in December so far. On the other hand, a growing number of media reports and social media posts that show crematoriums and funeral parlors are being overwhelmed, particularly in the capital of Beijing. It is reasonable to believe that China is underreporting COVID cases and fatalities, obscuring the scale and the severity of the health crisis when the country enters its deadliest phase of the pandemic. The sweeping changes to Xi's zero COVID policy allow asymptomatic or mild cases to isolate at home rather than in centralized quarantine, and slashed China's mass testing and contact tracing requirement. The sudden reversal came weeks after COVID-19 cases hit a record high of more than 40,000 a day, with every region of the country reporting an Omicron outbreak. Raymond Yun is a China economist at ANZ Bank. He said that despite official numbers suggesting the caseload had halved, observations indicated some cities, including Baoding in the northern province of Hebei, already had high infection numbers. More big cities, he said, would soon endure similar levels of infections. Like Hong Kong, the actual infection data will no longer be informative as the official infection figures decline. The government can eventually claim their success against the virus, Yun said. The situation echoes the dearth of official information during the disastrous initial outbreak in Wuhan nearly 3 years ago. Rodney Jones is the principal at Wigram Capital Advisors, an Asia-focused microeconomic advisory group. He said, "The behavior of case numbers is very similar to 2020, where we had 1 to 2 weeks with genuine case numbers before the veil was drawn. We have no idea whether we will see actual case data again, and whether the sharp downshift in cases reflects reduced testing or political management of the case data." A critical missing piece of information is the rate of positive tests, which is important to determining actual infection, nor is the real-time effective rate value published, depriving observers of a vital measure of the rate at which the disease is spreading. There are also discrepancies between Chinese regions in how case of death is determined and the definition of symptomatic. In some cities, including Shanghai, a chest scan is required before COVID diagnosis. Xi's decision to loosen zero COVID has led to fears of an unparalleled wave of infections and a sharply rising death toll. Analysts have projected as many as 1 million deaths over the winter months. China has reported a little over 5,200 coronavirus deaths. More than 4,600 fatalities were reported in the first few months of 2020, and about 600 during Shanghai's lockdown in April and May this year. One provincial health official said deaths would normally only be recorded if a person tested positive before seeking medical attention. Those who present with symptoms but have not had time to be tested and die from an underlying disease, these would be missed, the official said. He added that many colleagues were questioning the accuracy of the official death toll after authorities concealed fertility data in 2020. An intensive care unit doctor in Guangzhou said the data's usefulness was complicated by the fact that many seriously ill patients were avoiding hospitalization. Others were unable to obtain the PCR test result required for hospital treatment because of reduced testing. Chinese officials and the state media said the policy changes were designed to contain the epidemic in a more science-based and targeted manner. However, public anxiety is increasing about the healthcare system's capacity to handle a big rise in COVID cases and the discrepancy between the official narrative and the reality. After nearly 3 years, the costs of mass testing coupled with China's contact tracing system had become unsustainable. As local government coffers dried up, the decision to depart from mass testing was essentially forced upon Beijing. Now, that left China with an even bigger problem. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.